Tendinitis is a common condition. Most of us have experienced tendinitis at some point in our lives. Typically this is tendons are what attach muscle to bone. And so typically when a tendon is irritated, which is what tendinitis means, typically any motion that activates that muscle will aggravate the tendinitis. So your bicep, for example, flexes the arm. So if you have a bicipital tendinitis, if you just resist this motion, oftentimes that will make that pain worse. And so the challenge for treating tendinitis is to figure out what is actually causing the tendinitis. Because you see, as the muscles attach to bone, those attachments should be relatively firm. Unfortunately, with injuries, what can happen over time is that those attachments are not as firm as they should be. And so what can start to happen is we can start to develop some joint instability. And so often we have injury patterns that, again, a fall, a sports injury, these things can be from way back in our past, but we develop some instability in the joint. So that can be in the ligaments, it can be in the tendons, but as we develop that instability, we lose some of the biomechanical alignment in the joint that we need. And remember, our joints were designed to work well in a very specific range of motion. But what happens with injury is those very tight tolerances, down to millimeters of motion, we get extra motion. So now our muscles aren't working exactly as they should. So then what happens is when we use the muscle, we actually start to get pain and inflammation in the tendon. And this can contribute to a tendinitis. So the first thing I like to do when we have a patient complaining about tendinitis is figuring out why do they have a tendinitis. Sometimes it is very simple in that somebody overdid an injury. Let's say you're a bow hunter and hunting season is coming up and you went out and you practiced with your bow excessively for a weekend doing target practice. Well, that alone may be enough to irritate a tendon, and that may be a very simple self-limiting condition. But sometimes we actually have other instability somewhere where that muscle is having to work too hard. It's having to work too much, it's not working properly, and that's what's actually behind the tendinitis. And we find this in persistent conditions, a tendinitis that doesn't go away, it doesn't want to heal, or somebody that knows they've had a fair amount of trauma in their life, they've taken a lot of anti-inflammatories, and so we know that there's likely an underlying cause. So the first step for a tendinitis is finding out what is actually behind it. So a patellar tendinitis is when we talk about the tendons that are around the kneecap. So we have our knee, this is your thigh bone, this is your lower leg bone, and this is where the patella or the kneecap is. You can see that this is just surrounded in ligament and tendon tissue. And so the quadriceps muscles come down to a tendon that comes down and attaches at the lower part of the leg, and we can get inflammation in this tendon. So oftentimes what we'll have is pain with that flexion extension of the knee. We can have some pain around the kneecap, and oftentimes running will make this kind of pain worse. And so when we're dealing with the patellar tendinitis, it's very important that we look at the stability around the knee. And some patients that if the knee is unstable enough that it's causing a patellar tendinitis, which is a fairly big tendon, then usually we want to consider looking at the joint stability of the knee, maybe the hip or the foot, but oftentimes I found that the knee seems to have some instability in it. And the good news is this can be treated very easily with prolotherapy. Peroneal tendinitis is a tendinitis that oftentimes happens in the peroneal tendons, kind of on the outside of the leg down into the foot. This can cause pain that kind of shoots down the outside of the leg, down into the ankle, sometimes down into the toes as well. Oftentimes made worse by walking or running. I have seen high heels aggravate this in the past. And a peroneal tendinitis at times can be difficult to get rid of, but typically what we want to do is make sure that we're wearing good, stable, supportive shoes, and we want to find the cause behind why those tendons are getting inflamed. Sometimes stretching the foot, you can find some good stretches on the internet that can be effective, as well as as using some different kinds of herbal patches. 701 plasters can be very good. You can get those on the internet. They have a combination of Chinese herbs. Putting that over the inflamed area can certainly help. And Achilles tendinitis can often be caused by having tight calf muscles. When those calf muscles get tight, when we don't stretch them, when the muscles do have a tendency to shorten, that can cause extra tension to pull on that Achilles tendon. And what that does is then when we aggravate it by walking, by running, by hiking, and we start to get inflammation down at the heel where those calf muscles come down and attach to the heel. And so where those calf muscles come down attached to the heel, because the muscles are tight and pulling excessively, we get inflammation down really kind of where our heel, the back of the heel, and where our heel strikes when we walk. And so the Achilles pain from an Achilles tendonitis, I often recommend stretching. The 701 plasters, which are a combination of Chinese herbs, can be a very effective over-the-counter treatment, but usually stretching, and then I like to see those patients a combination of osteopathic manipulation, acupuncture, and if it persists, prolotherapy can be helpful in stabilizing both the knee joint and the ankle joint so that we have the stability that we need around the Achilles. Elbow tendinitis is quite common as well. You may have heard of tennis elbow or golfer's elbow. And oftentimes this is pain on either the inside or outside of the elbow. Oftentimes made worse by picking something up with the hand or carrying something, but use of the hand can cause pain that radiates down the arm. Usually this is fairly easy to diagnose on your own because you can come up to your own elbow and push around the area, and you'll find a tender spot that really reproduces your pain. We call this an epicondylitis. And this is an inflammation around the elbow joint. It's very, very common. And some physicians will treat it using steroids. And you can watch my videos and see I'm not a fan of steroids. We know that steroids, can cause atrophy in the tissues. We know they actually, over time, they damage cartilage, they reduce the muscle fibers, they reduce the strength of where the muscles attach to the bone. So rather than using steroids, which really just eliminates the inflammation. That's all steroids do. They just suppress inflammation. Rather than doing that, I prefer to take an approach where we try to find out why did that elbow develop tendinitis. Oftentimes it's due to some instability in the elbow joint and also some instability where those muscles attach. So typically by going in and using prolotherapy, which is a very simple, safe, and effective treatment where we inject a dextrose solution into that elbow joint, we're oftentimes able to provide stability to the joint, heal those insertions where the muscles originate, eliminate the pain, and get the function back. Now, if it takes a while for somebody to get in to see me with that, what I'll oftentimes recommend in the meantime, if they're suffering from elbow pain, is to get the 701 plasters. These have some Chinese herbs in them, and it's a patch that you can apply several times a day. The herbs will help seep through the skin and can help decrease some inflammation naturally. Stretching can also be effective. There's several different stretches you can find on YouTube for both medial or lateral epicondylitis. Medial you can think of as middle. So medial epicondylitis is the pain on the inside of the elbow, kind of towards the middle of the body, and lateral is that pain that's on the outside of the elbow. And so between stretching, the prolotherapy, some Chinese herbs, and occasionally some manipulation and acupuncture, usually most cases of this tendinitis in the elbow resolve very, very well. We have great results, and usually can help get that taken care of in just a few weeks.